Hi, my name is Dr. Alysia with Family Chiropractic, and one of the most common questions I get from people who have never seen a chiropractor, are chiropractors real doctors? Yes, while I don't have a medical degree, I do have a doctorate in chiropractic, which means I have taken extensive courses in anatomy, diagnosing, chiropractic education, and treatment modalities over the course of about 4 years after my bachelor's degree, which I got in biomedical sciences. The one thing we aren't as well versed in compared to medical doctors is pharmacology, is we're not allowed to prescribe medications. Well, what should I look for in a good chiropractic clinic? You should be wary of anybody who doesn't do an exam. A good chiropractic clinic should do a thorough history, have a pretty good intake paperwork packet. As much as we don't like filling out paperwork, it's good to know. They should do an exam, and that exam should include checking your range of motion overall in your spine, checking your reflexes, and a neurological exam to make sure your nerves are intact, and then doing orthopedic testing, which you often see us will be like testing your joint play, different things in certain areas of your body to figure out the true and proper diagnosis. Once the exam is finished, the chiropractor should move into, what did I find? Is the diagnosis more muscular? Did you strain a muscle? Is it more joint related? Did you sprain your joint? Or is the injury more nerve related? And then after explaining what my exam found, I often start my treatment, which can include things like heat, maybe some muscle stimulation, some massage work, and then the adjustment, or the adjustment comes first, depending on what a patient needs. And then it's followed up by some exercises, questions with the patient if they have any about their diagnosis, whether they should use heat or ice, and what they should expect after an appointment. So it should be very customized and not a cookie cutter plan that once all fits all patient. Do chiropractors only treat low back pain? If that's all I saw in a day, I'd be pretty bored, not gonna lie. But I would say 70% of my practice compromises back pain. But I see a variety of back pain, whether it's more muscle, like we talked about, joint or nerve. We've probably seen it. But just in the last 2 days alone, I have treated cubital tunnel syndrome, which is a condition that affects an elbow. I treated a patient for post-concussion symptoms, which included headaches and horrible neck tension. I've treated a patient who came in with horrible numbness and compression around her mid-back and sent her for x-rays for a possible compression fracture in her mid-back. I've treated an L5 nerve impingement, so we found out through an MRI that the patient has a disc herniation that is pushing on their S1 nerve. And then I also have a patient who has peripheral nerve entrapment in their calf. So these are just the random things I've seen in the last 2 days alone, let alone the last 2 months or 2 years in my practice here. So do chiropractors just treat back pain? Absolutely not. But I would say our specialty is definitely in back.